Hi everyone, welcome to our channel. So talking about the old videos that I have posted, I had incorporated about psychology and needs and various kind of perspectives, different kinds of perspectives that revolve around psychology. And then I also talked about depression and its causes, and talking about depression as being one of the major abnormality that the whole globe has been facing, and the symptoms and the variety of causes. Now let's move on to treatment that I am going to describe it in this video. So if you people have not watched my videos, those links are on the description below. You can find all my previous topics over there. So let's move on to treatment of depression. Fact claims that majority of people, they claim that they would not like to be treated because treating by going to any form of mental asylum or institution or visiting a psychiatrist has become taboo, like taboo in the sense of having something evil inside them, but it's not. Depressed is very similar to having a headache or having a stomach and then going to clinic, diagnosing it, and getting certain medications in order to eradicate it. So what I personally feel is, after my 5 years of in-depth study in psychology, I have heard that what I have heard so far is that the stigma of the depression, or the stigma of the example of somebody being depressed, is so much influential that somebody would basically commit suicide rather than going to a particular psychotherapist or psychiatrist. So once again I repeat that being depressed is very similar to having a food poison or getting a particular headache or stomach. So uh, it's very it should be taken as a very light way, that if somebody is depressed, then he or she should be taken to hospital. But not only hospital, there are a variety of therapies that I'm going to talk about it in this video. So let's start from the biological medications. Basically, I have already defined it earlier, but let me define it again. Biological perspective focuses on genes, on the DNA, or the particular functioning that goes around. It's very covert in nature. Whatever happens, it goes around within us. So biological treatment generally focuses on having medications. It's like a tablet, like Sinex, or uh, particular cetamol that we generally have when we have particular fever or common cold. So there are a few kind of medications. Yes, being a psychologist, we will be able to counsel them, but we have to be a psychiatrist. We have to pass a particular degree in medical field in order to counsel them. But the most typical kind of, I'm going to mention some typical kind of medications that we generally give to someone, but with the help of a certified counselor and with the help of certified doctor. So Prozac, Fluoxetine, Zoloft are the most typical kind of medications given to uh, depressed individuals. But remember, there's medications will certainly heal these depressed individuals within some percentage, within some level, like minimizing it by 20 to 30%, but it generally takes time. So we should not be thinking that he has started taking medications, it has been 1 week, so his depression will be erased. No, this is not going to happen, because it almost takes 1 month to get these medications into the healing process of the depression. So generally speaking, yes, these medications can help, but uh, it's uh, it's not that immediate. It's going to take time, and you have to take it instantly. And there are some side effect of having these medications too. Some people may have increased blood pressure, or some people may have morning sickness, nausea, vomiting, indigestion, or blood cholesterol problem or sugar problem. So there are a variety of symptoms or side effects that people might have while taking these medications. So let's move on to brain surgery. Brain surgery is not that much typical or usual kind of medication. However, in majority of psychology books, we find that brain surgery is also taken as one of the prominent part of eradicating depression. And the final one and most uh, unethical one is ECT or electroconvulsive therapy. I know it's very unethical. However, it is according to the course book. I'm just describing it according to the course book. Yeah, in almost all the psychology books, we find that this electroconvulsive therapy is so much prominent. I mean, it's written over there that this is the final part of this is the final treatment of treating someone who is very depressed. But what I want to say is that this ECT is only useful for theory. It's only useful for theoretical knowledge. It's not useful for practical implication because it's very unethical. So let's move on to other therapies which we call psychotherapies. Okay, now let me explain what psychotherapies mean. Psychotherapies are generally simple kind of therapy that are not much unethical, that are very friendly, and which are most opted by a psychodynamic perspective or cognitive perspective too. Under psychotherapy, we have uh, the free association or hypnosis or dream analysis, and we also have REBT or most commonly called CBT. Now let me tell you what free association means. Free association is something very similar. Let me give you an example. If XYZ is depressed and he goes to a certified counselor, then the counselor opting free association technique calls him inside and then lets XYZ tell whatever that comes to his or her mind. This is the theory of free association. This is the very useful technique. It's like the water is already full, the jar is already full of water, and now in order to make some space within that jar, the water has to be spilled. And in order to spill that water, what we have to do, we have to jerk that jar so that the water comes outside and there's some free space within the jar. So this is the technique of free association. The XYZ first goes to the counselor, and then the counselor starts asking him dozens of questions from the past or present, what he has been doing, or the future, what he would like to do. So there's so many set of questions that the counselor will ask the client, and the client will keep on talking and talking and talking in that rapid way that all the bottled up emotions would come out of his brain. So this is what free association does. Another one is hypnosis. Hypnosis is the science of drawing out fact and event from the unconscious mind. I think I've already described to you what ego defense mechanisms are. There are certain techniques of defending and bottling up our bad events and experiences. Like I had already given you an example of XYZ. If he or she has been abducted and if he or she returns back to home safe and alive, then he or she will be using ego defense mechanism in order to cope up in the daily life and facing the whole world. So while certain individual uses ego defense mechanism, it is going to adversely affect them, and in that fact that they will be forgetting all the memories associated in their life. And this hypnosis, this hypnotic condition paves the way of understanding whatever event or accident they had faced. The third one is dream analysis, and the name itself suggests what it is like. Uh, psychodynamic therapy claims that we have so many emotions and we have so many desire and we have so many obstacles running in our mind, running in our mind and running in our day. And what happens is that generally these things come in our dreams during while we are sleeping as a result of fantasies and nightmares. And generally psychodynamic therapy claims that's very interesting. Generally psychodynamic therapy claims that, psychodynamic theory claims that whatever we see in our dream is the representation of what we are thinking during day, or whatever the bottled up emotions we are having, we are hiding within us. Those emotions are the fact that we see during our dreams. So this XYZ, whatever he sees in his dreams, he goes to the counselor and then he writes whatever he has written, and then the then the counselor makes out series of facts that person has been facing. So REBT and CBT is the most prominent technique used by cognitive psychologists. REBT is rational emotive behavioral therapy, CBT is cognitive behavioral therapy. Cognitive behavioral therapy uh, radically attacks the negative thinking. We have cognitive triad: I, me, and myself. Now let me get it straight. Depressed individuals have these three factors that affects them deeply. First of all, they think that I never have a good life. The second time they think like this: whatever is happening, whatever bad luck that is surrounding me, it's all because of me. And in the final part, I'm so worthless, nothing is ever going to happen to me. When we people create a series of cognitive triad within our mind, we are most likely to be delusional, or we are most likely to be suicidal. So this is the case. And cognitive behavioral therapy breaks this triad, breaks this three series, so that there comes the other positive emotions inside the brain. Cognitive behavioral therapy, the only work of this therapy is to radically erase the misunderstood version of self, the uh, emotion that has been so much affecting the client, and this triangle, and is this triangle generally breaks off during this REBT, so that all the positive emotion goes inside the mind.